we need to talk about health insurance companies for a minute. And for those of you who are vaccine hesitant, this is especially important for you guys to hear because I think that this is something that is often overlooked and I think it's really important and offers another perspective. I think that it's no secret that all of us are not a fan of medical insurance companies. You guys know how it is nearly impossible to get anything covered these days. Patients, family members of patients, doctors, we all spend hours fighting insurance companies just to try to get life-saving treatment that we know that we need for ourselves or for our family member or for our patients. But there is one thing that insurance companies cover nearly 100% of the time, and that is well visits and vaccines. And why do you think that is? I want you to think about this for a second. Do you think that it's because the health insurance companies care so deeply about your health or my health or our kids' health? I think that we can all easily say that that is not the reason why those things get covered. The CEOs of insurance companies couldn't care less about your health, my health, or our kids' health. Frankly, they don't care if we live or die. But what they do care about is how long it takes you to die and how you utilize the healthcare system in that process. Because the more you utilize the healthcare system, that's more money out of their pockets. Because remember, insurance companies make money off of you paying a monthly premium, and then they hope that you will just continue to stay healthy and never have to pay for a treatment or diagnostic test that they're going to have to pay thousands of dollars for. That's why they always ensure that there's some level of a deductible that you also have to pay before they even pay for anything out of their pockets. You're paying a monthly premium and you have to pay a certain amount in deductible before anything is covered, except for well visits and vaccines, which are covered before you even pay a penny into your deductible. That has been the case for almost all, if not all, of the insurance plans that I have ever seen. Now, while these insurance companies may be cruel, they're not stupid. Their goal is to keep as much money in their pockets as possible. So why are they covering well visits and vaccines before you even have to pay a penny into your deductible? It's because they have done their research and they know that prevention is the key to health. Going to your yearly well visits, or for infants who go to multiple well visits in the first year, means that you could potentially catch something early, meaning that if it requires treatment, potentially you may need less treatment for less time and less money out of their pocket. Catching prediabetes before it becomes diabetes, before you are insulin dependent, before you end up in end organ damage, costing them thousands and thousands of dollars for multiple hospital visits until the end of your life. Catching high blood pressure when it's mild and maybe you just need some lifestyle modifications or one medication before you get to hypertensive emergency and end up in the hospital, costing them hundreds of thousands of dollars until the end of your life. Finally, vaccines. The hundreds and hundreds of studies that have been conducted that are out there for the public to see show time and time again that vaccines are safe and effective and have prevented millions of deaths and other long-term consequences of vaccine-preventable illnesses. Remember, when a child or an adult has a severe consequence of a vaccine-preventable illness, they don't die immediately. They end up utilizing the healthcare system for weeks, sometimes months. Those hospital bills come out to be hundreds of thousands of dollars. The insurance companies don't want to pay that. Again, it's not about caring about the life of you or your child. It's about caring about the money in their pocket. You know how sometimes the vaccine hesitant community likes to talk about how pediatrician offices get small bonuses for having a certain amount of their patient population fully vaccinated? First of all, let me tell you that is a very, very small amount of money that they receive for that, if they do receive that. And who do you think pays them? It's not big pharma. It's not the pharmaceutical companies that are making the vaccines. It's the insurance companies. Why would insurance companies pay pediatricians' offices a small bonus for them to hopefully talk about and educate their patients and families about the importance of vaccines and get their population vaccinated? Because it actually saves them money in the end. And finally, the last thing I want to say about this is that there is not one doctor who is encouraging you to vaccinate your children for money. There is not one doctor who is encouraging you to vaccinate your children who is not also vaccinating their own children. I know you care about your children. I know you want to do what's best for your children. I don't doubt that for a second. But the blatantly false information that is out there and continues to circulate all throughout the vaccine hesitant community is actually leading you to do the opposite. You're putting your children's lives at risk every single day. And the only reason that you have been able to get away with not vaccinating your children for this long is because of the herd immunity that we've had for so many years. But as we see now with the current measles outbreak ravaging its way through the United States, we no longer have that herd immunity because of the decrease in vaccination rates. 2 children with no underlying health conditions have already died from measles this year. That's 2 preventable deaths from a virus that was eradicated here several years ago. Those are the first 2 deaths, but unfortunately, they will not be the last. Please, please listen to the science, listen to the doctors, listen to the epidemiologists. We just want to protect your kids the same way that we want to protect ours. If there's one thing that I think health insurance companies have done right, and I do believe it's probably just one thing, it's this one. And it may be for selfish reasons, as it always is with them, but it actually benefits all of us.